Yeah. So you mentioned the soap note taking. Why have you asked this?
I was going through a book again, and I do have problem, right? I do diligently make notes, and you've seen me. I write everything on it, right? Because I want to
Mm,
write my heart out while I'm taking notes because I'd forget. So
yes.
but then I realized that that particular, I can't even give that prescription rather, that particular piece of document to the mother. So I go home, write another one, which only needs things that they need to know, not my observations, which particularly they don't need to know as of yet. Maybe that's something I may be wrong with. That may come up
No.
later, not at all. Yeah. So, but how else do I do it that I am able to document in my diary later the stories and also be very comprehensive with the documentation. So it was in Hands and Hearts and Hands. What's that
Yeah.
book?
Hearts and hands.
Hearts and Hands. Yeah. So I was just reading and it talked about soap. So it reminded me, and immediately I texted, let's discuss, because it didn't have a lot of details. I remember you were explaining to me back then pretty much in detail how this goes.
Okay, so interesting. Documentation has just come up in discussion. So one of my women who's been attending home births on her own, she worked with Gori for a while and did Gori's course. And so she doesn't document, she just sits there and does the birth and walks away. And that's okay, that's fine. So she was kind of saying a comment about, oh, I know somebody else who watched her was saying something about her being hands-on and she's not taking notes. And I kind of had to clarify, it's not like I'm standing there with a woman crowning and I'm sitting there jotting down notes. There's constant breaks in a labor now, isn't there? Constant. There's far more breaks in activity. So during the breaks, I'm always charting everything. And you never know when it's going to come back, and you look over it and you need to know that information. It can be something simple, as you said, Divya, with Sulalita, that she suddenly out of the blue started asking about hemorrhaging, out of the blue. And so you might have noted something like that. And then we go back, oh, wow, she actually did mention this. And sure enough, she did drop a lot of blood. I was speaking to my son Outlaw, I call him, and he's a nurse. And he was talking about documentation because in the Western world, documentation is important. If you did not document it, you did not do it. So let's say you wheel in a woman for a cesarean section and all you manage to put on your notes is baby boy delivered at this time. In the West, they will attack you. Why did you do a cesarean? Where are the notes? Where are the records to say you needed to do this? So in the West, we record everything. And that's okay. So on a legal level and on a defensive level, we record everything. And in particular, Divya, with you and I, with that KM, with Karuna Mai's situation, that was really good that I could record it. Not only that, actually, I just gotten bitten this morning. I don't know who it is, but I think it could be Sulalita or it's the last birth I transferred. Somebody has made a complaint and it came to me this morning. But unless the way I work, and it's the only thing that works, unless it's documented, it did not happen. You understand? And it's the only real way we can actually get information and data. I know in India, they work on a different level. And so the way it was explained to me because I do, and Dr., you saw it, Sulalita's birth, her husband's a doctor, and he was amazed at how much notation I was taking. He goes, no one would write this in India because they would be charged. Whereas in the West, you write it or you get charged. If you didn't write it, you didn't do it, which means you were irresponsible. And yes, debriefing is very, absolutely. So a lot of stuff goes on in birth, and a lot of it, sometimes it goes in the background and you're not really, you don't realize how significant it might be till later. So we just keep writing, and there's no harm in writing too much. There's a lot of harm if you don't write enough. Yeah? That's number one. And then so recently with one of my students who was asking about this, I make the explanation because we work in teams. We work in teams. So I hand my charts over to somebody else. They open the charts and they're right back at page one. We're all on the same page. We all know what this woman's been going through, what the steps have been, what we've done with her, because the chart is handed around and everything. Oh, I don't need to discuss this with her because it's already been discussed. I need to discuss this because it came up in conversation, like this. So if you're working in teams, it's essential. If you're an old person, or actually, if you occupy a human brain, if you are working with a human brain, document, because brains do not remember. Brains forget. And it's amazing when I look through anything and I start reading what I documented, and I've always forgotten something, always. And sometimes what you forgot could be very important. Technically, again, especially in the West, your documentation is a legal document. You cannot, if you are a medical practitioner or a caregiver on any level, you are required by law to document everything, not just your tests, absolutely the tests, but everything else. Because in the West, they will take doctors to court. Doctors will go to jail, and doctors will lose their licenses and never be able to practice again. Whereas in India, where if you don't maintain this documentation, and that is what was explained to me, the doctors explained to me, the reason why they don't maintain documentation is so no one can come back at them. Whereas in the West, it's the other way around. If you don't not document, you're dead. You are dead. That's one thing. Now, specifically, you asked me about SOAP. So SOAP stands for subjective, objective, analysis, and plan. So subjective, I'm going to use one now. Here's one, and I wish my women were here, but they're not here. We are dealing with a woman, and I've mentioned her before. She is the one who's had a prolapsed bladder in early pregnancy. And we've had a lot of complications and issues in trying to diagnose this because the hospital can't find the bladder because the baby's in the way.
So the latest was that he didn't have a bladder prolapse?
This is the bladder prolapse lady. Yep. And their excuse was they could not find the bladder because the baby was in the way. Now pick up a book of anatomy, any book on anatomy. It's not possible unless he's doing the ultrasound through her butt or through her back. Then the baby gets in the way. But no, I was watching him. He did it like everybody else on the abdomen, and he could not find the uterus, but actually he was just making a fool out of me. We have a song, trying to make a fool out of me, Coconut Man. So he was making a fool out of me. He kept saying he couldn't understand my Russian. I don't speak Russian either. I'm speaking to you in English. No, Mataji, I don't speak Russian. Me neither. So, but this is the game we play in India. So with this woman I'm dealing with now, so subjective, complains of prolapsed uterus, complains of being tired. I get a phone call a few days ago on Sunday. She passed out at the park. She is now 35 weeks pregnant, but from about 26, 24 weeks, we've been working with her, and there is not a day that goes by or a week that goes by that she doesn't have a problem. So, prolapsed bladder. Subjective, continuing with subjective. Subjective means it's things that she's told you are things that you see. Objective are test results. So subjectively, she complains of a prolapse. Subjectively, she complains of a heavy, dragging feeling. Subjectively, she does not feel like she can stand up straight because it feels like her baby will fall out. Subjectively, she is feeling very, very tired. Objectively, so according to test results, upon visual examination, I can see I can see bruising and discoloration around the urethra. I can visualize what appears to be a prolapsed bladder. I should have been able to add to this list of subjective elements an ultrasound result, but they screwed up the ultrasound twice, so I have no result from the ultrasound. And I would just say that in my note taking. What else do we have? Oh, so on Sunday, I get a phone call from the husband and from various other people that this mother is passed out in the park. Well, okay, good question about the ultrasound. So this is the deal. I was asking for an ultrasound of the lower pelvic organs. I was not asking for a prenatal ultrasound. I did not need any of this information. So I am looking for what I was looking for. If you're doing a prenatal ultrasound, you have to have that bladder full, right? To get through it, to see through it, to see through the baby, to the baby. But in a lower pelvic examination with an ultrasound, you only partially need to fill up the bladder. Now, with this woman who is complaining about bladder prolapse, it is completely contraindicated to have her fill her bladder. And they had her filling her bladder and filling her bladder and filling her bladder. She could not hold it in. She would go into pain. She would wet herself. They would scream at her and make her go out and drink more water. She'd wet herself again and they'd scream at her some more. And then I came in to stop this and say, I never asked. Again, they're giving me the gestation age of the baby and the position of the baby that they did 2 days earlier, and I never asked for it. I don't give a shit. I want to know about her bladder. But yes, they kept traumatizing her. Exactly right. They kept traumatizing her and causing more trauma to her organs. So I took her out of there without the results that we went in for, although she paid for it. Exactly right, Krista, what you're saying. So yes, ultrasound. Look, I won't say the ultrasound will be risky, but I will say if you're suspecting prolapse, to fill the bladder beyond capacity is contraindicated. This is why I'm sending her in to be checked. But there is no respect for me. And in fact, even this morning, I'm going back and forth over this because I have no paper that this ultrasound technician has paper that I wipe my ass with his paper. He knows nothing. His alternative suggestion is to send the mother in for an X-ray. So this guy needs to go back to school. Maybe start with 1 + 1 = 2, because you're an idiot. Yeah, I'm really pissed off now, but I've not slept well. I'm getting worse. All right. So yes, I would have been able to add into objective ultrasound results had I gotten any, but I did not. So right now something's happened. On Sunday, this mother, as I say, exactly right. They are not supposed to suggest. I told them exactly what I wanted. They don't know anything. They don't know the history of this mother. They don't know. They can't even speak to her because she doesn't speak English. Yeah, it's just pathetic. It's just a God thing again. Where can we read about the soap method? Just look it up. It's quite a common thing. And there's soap. And I actually I'll try to download it. It's quite a thick document actually about what soap is, but I don't think it's not that as complicated as the number of pages. As I say, it's just subjective, objective, analyzing, and then the plan. Now, after soap comes soapier. So I forget what it stands for, but I think you come back, what would E be? And then results. So I know after the P, you come back, the woman comes back to you and you reanalyze what just happened. So again, going back to the situation. Furthermore, to the objective on Sunday, she passes out at the park. So I'm told. When I get there, somebody calls an ambulance. Of course, okay, it was me. I did tell her to call it, but that's besides the point. The ambulance shows up. I get there. I take her blood pressure, which is 96/60 something. So it's okay. I suggest, because at this point, I've been working with her for a while, and I do quantify and clarify. I am grumpy. I am old. I do not have the patience I used to have. And so Induleka is taking the lead in this one. So she shows up at the park too. And I'm looking at her and I'm testing her. Okay, what do we see? What do you know? What do you think? This is what I think. So there's the ambulance. I say, take her to the hospital. Why am I saying this? Because she calls me every week with some problem. This mother has had a problem since I met her. It's the prolapse. She's feeling exhausted. She's feeling all of a sudden she feels like she's got high blood pressure. So she sees an Ayurvedic doctor who gives her medication to lower her blood pressure. And then she goes to the park and then she does parikram and then she fasted during the morning and she forgot to drink. So at 1 o'clock, she passes out. This is not okay I'm kind of getting off the soap. Okay, so we put this all back into subjective. She passes out. And I'm going to add to my subjectiveness. Everybody was surrounding her. I asked her if she wanted to go to get in the ambulance and go to the hospital. No, she says. Okay, the ambulance is here and you have to walk about 50 or 100 meters and then up 2 flights of stairs. Are you able to do this? She can't lift her head. She's feeling so weak. Okay, well, let's get the ambulance to help you up the stairs. No, she decides. And then she walks away with her entourage and manages to go home and get into bed. Also, I'm her neighbor. So I do get regular phone calls about how weak she is and that she's in bed, except that when I look out the window, there she is cleaning her windows. And there she is going about doing things. So at this point, after the park incident, we are all at a bit of a standstill. And my position is, again, grumpy old lady, but this woman has had complaints throughout her pregnancy. She has had, put it in your subjective, she's had kidney stones that were removed through her urethra. They went into her bladder and removed the stones through her urethra. So it's very, very likely, A, she has a kidney weakness. B, that some damage has been done to her bladder and her pelvic muscles during this situation. So for me personally, it boils down to a question: are you healthy enough to give birth at home? Next question: do I want to support you? No. Ah. Okay, low risk and high risk has been analyzed by doctors. And their high risk is not my high risk. Their low risk is not my low risk. Now, Induleka is looking after this woman. So, it's an interesting dilemma, and it's an interesting conversation that's coming up, because I know what I'm doing and I know what I'm saying. If I don't take on this woman, I'm throwing her to the wolves, right? Right? That's what I'm doing. And that's exactly what I'm doing, and I know it 100%. So there's say, take the mother to the obstetrician, see what the obstetrician has to say. We all know what the obstetrician's going to say, right? Okay, so Induleka, who's much younger than I am, and newer and fresher, she feels for the woman, and I totally understand that. She wants to give this Russian woman a good chance. I don't, and this is why. I already know what this is going to look like. This is going to be a long labor. The mother is going to complain the whole way through. I'm lucky if she can get herself strong enough to do what she needs to do, because so far she can't even be pregnant without a lot of help. In India, it's a huge risk. Things are different there. When I transfer, it's a lot more hellish. It's hellish for the mother. And frankly, she's in hell anyway. There's nothing I can do for her. If she goes to the hospital, she's in hell, and I can't save you. A little bit, maybe if she goes to the hospital now and gets mistreated, maybe she'll pull her pants up and get on with the job. But if you can't think to feed yourself, if you've been having ongoing problems with pelvic floor issues, and you're going exactly against what we tell you to do, I don't want to take the responsibility. And I have a lot of other mothers I'm responsible for. Yeah, responsible for. And I've been only honest with my age and my temperament and my ability to keep going. It's not going to last a lot longer. I'm serious. So wouldn't it be better to straightforward go to the hospital? Yes. That's what I say. That's what I say. I know she won't be. So I said this to Induleka went to her. He spoke to her. Not exactly as roughly as I say things. I mean, I don't speak to mothers the way I'm speaking to you. I'm letting it all out, but I'm much more, what is it? Diplomatic when I'm dealing with the mothers and the families. I'm honest. I'm honest. And so the feedback I got from the mother was, so you're going to give up on me now? You're giving up on me. And I think, oh, okay. And then this defensive dialogue comes on. And I've been here before, right? I've done so many births. I recognize the signs. From the day I met her, she has always had some complaint. A complaint I have not been able to address. She has a homeopath, another Russian midwife, right? So that woman is not taking. Exactly. I cannot fix you. I am not a doctor. I am not a goddess. I am a smelly old lady. This is your job, isn't it, shaman? Shaman, it's your job to be healthy and be ready for your birth. It's not Tapasi's job, is it? It's not Divya's job. Who's having this baby? You are. Now, if you're sick every step of the way, if you can't carry your baby, or if you can't eat, or if you don't know when you should drink goddamn water, girl, go to the hospital and get an IV. Yeah? I have a Russian friend who is always exactly complain, not really ready to do something to pull it out of her, pull herself out of it. And this is the message. As midwives, we are completely different from doctors, especially in India. We do not save anyone. We help you. Yeah, Divya.
So while I was training, or I am training with these, not really training, taking classes with these two midwives from US, one of the modules was you also put across, and it was very much in the beginning about what you're telling us now, that the moment when you are speaking to the mother about how things work, you also speak about the facts that when required, there might be a transfer of care also when it looks like. So Desiree speaks a lot about times, because she also works with a lot of with people who do drugs, and she does take on different kinds of people. And so she does say that, she does speak about the fact that what if, things are out of my hands, and now really, or maybe not out of my hands, it's not a mutual, it's not going where, yeah, where we intended to go, and maybe there might be a dialogue about it or a transfer. She has like Krista said, like, risk out of your care. So she has done that, and she does tell us that it's not that you can't risk someone out of your care if it's better for that person. If not, because it's a mutual relationship, but there can be a dialogue about it. Autonomy is for the midwives as well as for the women, both. That's what the first two modules were.
Exactly. And it's very easy to put yourself and your own needs in the back. But for the rest of you, you have children, you have families, and you actually have to look after yourself and your families first, believe it or not. And we always put our families on the back burner while we go to women. Always, always, always. So those women have to, and you just can't help somebody. I mean, I can support somebody in this way, be super helpful. But it's their, you know what it is. You know what it is. But in India, it's another game. So again, it's very hard to just pass somebody over to the system, because you know it's going to happen. So maybe what I mean, a little bit in the back, I'm hoping maybe if I pass her over to the system and she meets the butcher of Manaram, who's now the gynecologist at our hospital, who told this other couple, what do you think? You're going to have your baby by yourself? You know, because they were asking questions. Maybe once she goes to the hospital and meets what's out there, maybe she'll pull her pants up and become a big girl again. But when again, I am older, I know my own weaknesses. I know I have an issue with people who are always whingy and complaining and can't do things. I do have a problem with this. So I try to tolerate. But if you don't pick yourself up and you're trying to have a baby at home in India, it's not going to work. And you're going to drag me and my mind and my suffering through a whirlpool of hell. And then I have to go back and attend another birth. Absolutely. You know, it's so funny. I watch the women now who my students with me, and they come with me to births or something, and they're so wiped out after a birth. And I kind of look at them and I got to get up and go, they got to take 3 or 4 days off. I'm going off to the next birth. You're giving young youth a bad name, you guys. But it's so draining on your mind, on your body, on your heart. It's very, very heavy. Yeah. And everybody wants you to save them. Even if they think they don't want you to, they actually have this hope. They pin all their hopes on you, and that's heavy responsibility that I do not want, but they keep throwing it at you. So that would definitely be the next step. I was hoping Indaleka would be here, but she's not. I did speak with her this morning, so she's going through her own personal stuff because she's Russian, and Russia's shit's going down in Russia, so shit's happening in her family, which isn't going to help this situation. Which actually, to me, just confirms either you take responsibility and make yourself healthy, because neither of us have it in us. You know, I'm happy to help you and be there, but only you can birth this baby.
Do you feel we've talked about, so was there any improvement after the homeopathy that we gave her? No.
So, and I was of course, I'm a naturopath, so meaning I've studied homeopathy. So as the homeopath rightfully said, homeopath and actually all naturopathic medicines look at natural cures that are fairly organic. And we also acknowledge that a lot of illnesses come from what we say distress, which means we're in stress. Our disease, meaning we are not at ease. Imbalance, exactly right. So with natural remedies, we're trying to bring you back into balance. We're trying to fix these things, adjust these things. Now, if you're going, okay, thank you so much. Okay, thank you. I'll try. RICQ, yay. You going too?
Yeah, I'm
Come on. Okay, 1 second. My grandson.
My randoms.
My brain, say that again.
My randoms.
He said, hi, randoms. See ya. Take care. Um, what were we saying?
Imbalance. You want to bring things to balance with
Okay.
homeopathy.
So this actually, so when there's, okay, so when the homeopath was trying to treat her, and we came to the conclusion based on her medical history of having kidney stones, having them removed through her bladder, through her urethra, that these were injuries to her body, not just being an imbalance, right? Where you can, with organic medicines, natural medicines, you can bring people back into balance. But I cannot heal your arm if it has been torn off your body, right? Natural medicines will not do that. So if this woman has a physical problem with her bladder, with her pelvic muscles, with her kidney, and with her kidney, this is another thing that happened at the park. We looked into her eyes, and again, I'm a naturopath, so we study iridology. We could see a yellow glow all around her eyes that were much lighter than they usually are. When they go light like this implies inflammation. Yellow, a yellow color means kidneys. It all matches. It keeps matching. On my mean side, I think she's just being a wuss, being a big baby, and she needs to pull up her pants. However, if I put down my mean side and kind of try to be objective, and I look at her objective notes, I do see the yellow coloring. She does have this history of kidney stones. She does have this operation history. I can bloody well see the prolapse and the bruising and the trauma that's caused to her urethra. And she constantly, and I cannot reassure her enough that her urethra will not be torn off with the baby's delivery. She constantly has a concern about her urethra being torn away. Not that I've ever heard of it, but hell, if you keep bringing it up and you pass out and you have all these problems, maybe I'm not just a mean bitch, but maybe you actually have a problem that I'm not ready to take care of at home. And the only way we can actually analyze the problem is take you to the hospital or to another qualified doctor to run tests on you. But the problem is, are there any qualified doctors? Exactly. On the physical level. Well, it certainly opens up questions, doesn't it? So I do try to take into account. Reiki, yes. Reiki, acupressure, massage, yoga. We did everything with her, and even sending people in to hang out with her, because I ended up putting her on bed rest because everything I could see was get her in a knee chest position for 15 minutes a day, 3 times a day to get the pressure off the bladder. So, okay, she does this. And then when I started going to see her, she was hunched over all the time. And she would just walk with her legs crushed together and holding her crotch, trying to keep the baby in from falling out. And I asked her, why are you doing this? Because I'm afraid the baby's going to fall out. It took me a month to get her to stand up straight and do some exercises to hold her belly up and create strength and start, but always something else. So the last thing is passing out. I do see signs, naturopathic signs and iridological signs of kidney issues. So I'm not happy. What do you guys think? All right, so get back into the soap. S-O, you've got the S and the O. Analyzing. So right now we are all analyzing on the table. This is the analysis. Question mark. Is this physical? Does she have a kidney problem? And then I did do research on bladder and all this stuff. It doesn't look so pretty. What else do I analyze? Question mark. Is this emotional and psychological? I don't know. My feeling is like that, but again, I know I'm an ass. Some pressure in the family to, oh, no. She's on bed rest. There's no pressure from the family to work, but her mother works within a medical thing. So in the beginning, the mother was hammering her, and people would get on the phone from Russia and were hammering her with their fears. And so we told her to hang up, and that stopped. So no, there's absolutely no pressure to work, but it is a lonely state. When I go in that house, the husband and wife have separate rooms. It's very, very minimalist. There's a big living room with an altar and nothing's in it. It's, devotees live very sparsely generally. And you go into her room and there's only a bed, and then you go into his room and there's his bed and his computer, and that's the life. So if she's in bed, she's got nothing. If the woman gets something unconscious, yeah. So it's interesting when she'll call out with extra issues, she's done something, like gone out. She decided to get up early and go to the temple and then do parikrama and fast. And she's done it more than once, and then she calls complaining that she's not well. Yes. I'm constantly having to explain to people here, do not fast. You're not supposed to fast if you're pregnant. You're not supposed to fast if you're breastfeeding. Just don't fast unless you're old and fat and no pregnancy. No, I have people do Ramadan. I have people do prolonged fasting, and they found people who do this have premature babies. So no, I never promote this. If you want to fast, do what we call an ekadasi fast. Don't eat grains. You can eat fruits and vegetables, but no grains or beans. Be practical, but do not fast. This is what I personally feel is happening. That's what I feel is happening. I feel like she's creating situations so that we all have to come running and look after her. And I don't want to do that. I don't want to do that because it's the same thing. When the labor pains come, they're not going to be able to handle it. I don't want to do this. I know I'm getting grumpy. You guys have to do this and walk people through it, but I don't want to do it anymore. If Indaleka wants to do it and support this woman, she can. I will give her all support. I'll pat her on the head. Oh, poor dear. Oh, I'm sorry. I'll do that. I did want to kind of explain it because I know where I'm coming from, but I want to be fair, right? I want to be fair. Yeah, so I'm pulling out my shortcomings so I can give this woman a fair go at what should be done. So actually, a good person who still had energy could sit down with her, shake her by the shoulders, knock it off. Get your shit together, girl. And, in fact, this is what just happened, didn't it? At Sabita's birth, the Bengali lady who had the home birth just recently, I was ready to throw in the towel. It was hilarious because I'm grumpy. And everybody in India can't handle the labor pains. The first bits of labor pains, they freak out and they can't handle it. If you can't handle that, you're not going to handle the rest of it. You gotta swallow. Swallow. I'm sorry, just swallow. I was so prepared for Sabita's birth that she wasn't going to swallow the pain and that I was just right, just transfer. They're not going to put up with this. Well, sure enough, I was ready to throw in the towel. Denise was there, Radhakund was there, and I deliberately called Kalindi because she's Australian. And I knew she'd get to Sabita, this Bangladeshi woman, and read her the riot acts in a way I can't do anymore. I'm kind of soft, even though in my heart I'm going, "Rah, rah." But Kalindi just said, are you going to do it? Do you trust Bhagwan or don't you? That's all you can do is trust God. You know, she's just laid the Aussie on her and just kind of went hard for leather. This is how it's going to be. It's not even looking. You're like one of my kids. You're ignoring me. I'm pulling on the best. Oh, well. So Kalindi read the riot act, and actually I did say one good thing. I told them, okay, look, how about you're not in labor anymore? Just put it off for the day. Go to sleep tonight and we'll start labor all over again tomorrow. I thought that was a cool answer. And they all agreed. Okay, we will stop being in labor now and we will start it up again in the morning. So they all went, laid down, chilled out. And of course, as soon as everybody lays down and chills out, the labor picks up. So of course she had the baby at 7:30 in the morning. But I was ready to transfer because I'm starting to get jaded, we say, or tainted or contaminated. That I do find in India, as soon as the initial labor cramps come in, many women tense up and fight it and can't relax. And I don't have the patience for it. So if someone else who's younger, like Divya, you were there through labors with me, and you must have noticed I'm stepping backward. In fact, I'm going to bed. I'm going to sleep. Well, you guys do the hard work, right? Which is hard work. Massage, supporting, breathing, doing this, right? Doing this for a whole long contraction, or this, right? This. You go home. You didn't give birth, did you? Oh my God. I've just been hit by a bus and I didn't give birth. So, you know me, I'll lie down while you do the work, but because there's a lot of work in this. It's glorious work and you should do it because you're young. I'm out. I don't know if that helps at all. Yeah. What do you think? What do you think about what I'm saying? Go on, Divya.
So I was thinking about the options for this woman, because now what has come out of the analysis is clearly there's another issue on a more emotional level. And there is a support probably she's not getting elsewhere that she's looking out from us, maybe in terms of responsibility also to a greater deal, that, somebody would fix this for me, because she doesn't know how to do it. She's still deep down in the spiral. I say this because I've met people and it's not their fault. They are deep down in the spiral, in the abyss. They're so dug in that they have to be slowly taken out. And that does need a lot of work. But we'll have to figure out how to do this. Maybe check with Reiki, maybe do some sessions, chart out plans for her, maybe give it to her
Yeah.
and let her, including risking out of care and what can lead to what risks. So maybe if this works out, we go here and we want to go here. Home births are the best. And even for you, KL, if it works out at home, that will be the best, because transferring to the hospital is another nightmare. And that doctor,
Oh,
I
yeah.
don't even
Yeah.
think so. He's logical enough not to talk for induction. I'm scared of doctors. All they know is induction. They don't think through. So maybe chart out all plans. Do you want weekly support? 20 minutes talking about your dreams, your fears. How do you visualize birth? What do you see? What do you know of birth? What are the stories you've heard? Maybe all this is done. Maybe we need to repeat it a lot of times, and then also clearly, very clearly chart it out and tell her that if this looks like, if this is how it goes, one direction, another direction, another. And maybe if not, there is a chance that risking out of care maybe, and we need her support. We definitely need her to know in her heart that people are there for her. But
Mhm.
we would need her support to be able to help her also. Maybe
I
again.
completely agree. I completely agree. And that is the better holistic approach to it than mine. So that's what yeah, you're right. And that would be the right way to move forward. So SOA, we've analyzed. Now what's the plan? The plan now is to talk to her frankly. We can discuss responsibility. We can discuss what happens if we transfer. What are the alternatives? So also that came up in discussion was, should we run? So the mother asked, and Induleka is asking, are there more tests that we can run? Maybe. Now, okay, she's complaining. Okay. So we find out that she said she felt like her blood pressure was rising, and therefore she saw this Ayurvedic doctor who did check her blood pressure and agreed it was on the rise. So he gave her medication to bring down her blood pressure, which is when she passed out. So in fact, throughout her pregnancy, she has not had high blood pressure. It's never been over 100 over 80, I think, or 70. 100 over 70 is the max that this woman's done. So why is anybody giving her medication to drop her blood pressure? So, and then why is she doing this anyway? And this is another thing, how many people are you speaking to and getting advice from? It gets complicated if I'm saying you don't have high blood pressure, and I'm actually telling her you actually need to do some exercises. You need to, in fact, we got her to a point after the bed and doing these other pelvic exercises. Okay, things are lifting up, start going up and down those stairs. Go up to the roof and come back down. Lying in bed is bad news. It's never good news. And if we want to get you healthy and get your heart strong, which you've got to do for labor, get up and start moving. Bed rest is not very good. So we do these things, but then she goes off doing something else without us knowing. Anyway, it's just interesting. Oh, now you show up, Radhakund. You should have been earlier so you could partake in all of this. But anybody else from what I've explained to you? So Shaman, you're a mother. Kalyani, you're a doctor. What are your thoughts on what I'm saying, I wonder?
See, I'm very much impressed about the work, what you are doing. That's why I'm just, following you. So, of course, recently I have read an interesting article. I would like to share it in the group also. See, actually, just 2 decades only we are practicing this, okay? That traditional hospital-based, scanning and other stuffs and medications. But just 2 decades back, and all our grandmas and mas and all, they took birth in the house, means a home, very healthy, very happy. The dachi, we called as dachi in North India and Martuvachi in South India. That ladies have like people like you, that means traditional midwives. The work what they have done, the knowledge what they have already is just science is yet to step into their research on it, and they are failed doing that and keep promoting their work, not even giving ears to listen them. That is what the big problem is happening. That's why even I wrote a letter to government also, like, please encourage midwives. And then if at all, if you want to guide them with a proper little basic, means like, with guidance, just add the value for them. Add the value, but you are simply supporting the doctors just with a small 2 decades of knowledge. You are praising them like anything, but 100 years of ancient knowledge with proper understanding. The midwives are saving so many girls with mothers with less complication. They are happy with that. So you need to appreciate and recognize the midwives, those who are practicing in India. That's what I'm keep writing letter to government. So I really agree that what are the problems you are facing, how beautifully you are managing. It's kind of heart to heart connection. People are very busy with subjective, return, report, evidence, these and all. But human beings are so complicated. You can't give it, even with the 50 case studies, how can you say this is subjective and objective? Whatever it is, see, why don't they give their thought on it, heart to heart, mind to mind, something it's unique. Each and every pregnancy unique. When it comes to medical practices, they have a certain protocols and procedures. Even they don't want to put their mind out of it. I sometimes I feel that whether they have heart or not, just simply they are making pregnancy complications. Modern medicines, of course, it's very few goodness is there, but most of the time it's really, I feel so bad about it. That's why I'm just completely following you and would like to be with you people like so to support next generation. Yes. So much. Thank you so much. Yeah.
Thank you. Thank you.
Yeah.
And Shaman, what do you think? As a mother, what do you think?
Hi. So I've been in a midwifery care model for all 3 of my births, but they have all been so different in so many ways. And I am somebody who finds it very, very difficult to ask for help. And because I've been conditioned like that. And the thing is that when I ask for help, that's not the help that is offered to me. Something else is suggested, which is not something that I need. So it's like when I just want you to, how you say, I just want somebody to hear me out and not offer a solution to me, and so the lesson I learned from it is that I stop asking for help. So I'm kind of, I'm like, I just go within, and it happens with the closest relationships also. So like you were saying, I think in all of my what I remember from all 3 of my labors, all the help that I needed was to be held like that and pressed on the back. That is pretty much all. I didn't want to be told to do the stairs. I didn't want to be told if I should go to the toilet or not. I didn't want to have a conversation. I didn't want to discuss what I was feeling. I was very quiet and silent through all of my labors. But that was taken as something that I'm zoned out, or that, of course I'm zoned out, but that doesn't mean that that it's not how it is meant to be, but, and so, like if I say that all I want you to do right now is hold my baby, so I have 5 minutes to myself. But when somebody is holding my baby and I hear the baby cry, I'm not aligned. Then I can't be in my own zone, And the other person is like, no, let me do this chore for you. Let me go do the laundry for you. But I'm like, I want to do the laundry myself. Because there's a certain way I want to fold the clothes. And you can't do that. And I don't want you to feel bad about it. And I don't want to feel bad about it. I'm just saying that I want to do the laundry.
You can do
And
mine too. Go on.
Yeah. So, all of those things. And sometimes I feel like, in order to refuse certain people in my proximity, even though I'm very close to them and I know that they only mean love and care, but there is somebody else that I might want in to be around. But because, it would become like a thing that how could you choose that person over me? So I'm like, I don't want anybody. I'm going to be fine by myself. But the truth is, I would want certain kind of help from
Mhm.
certain people, you know.
Yep.
So, it's just like I remember even with Corina, in my second birth. See, I refuse to have a backup doctor because I don't want to have a backup doctor. And when they say, what if there is an emergency? I'm like, an emergency is an emergency, then you treat it like an emergency. You take me to the closest person that you can find based on the resources available and the situation I'm in. I can't plan an emergency. I don't know the nature of emergency. And I can't let that influence my pregnancy right now.
Mhm.
But that is like, I don't know how Tapasya Appa, because even in her protocol, she also had this thing that we had to have a backup doctor. But when I said I don't want to, because I can't think of anyone, then she agreed to going ahead without it, to supporting me without it. The other thing with me is that I think I'm always trying to comfort others.
Mm.
So even when I called Tapasya Appa at 3 in the morning, my labor had begun like 12 hours uh, previously, and I kept her, I kept in touch with her, but I'd only called her when I thought I was going to get into active labor. But it was a cold November night, and I was like, there's only a single bed in the room. I need her to sleep. Can you put a mattress for her? Can you just make it comfortable for her? So, sometimes I feel that at least in those moments, I don't want to be thinking about that. So, the more the people in the room, the more I would want to the more focus shifts from me to the other person. That's just how I am,
Mm.
you know. So I and I think what is difficult for everybody, I don't know if it's an Indian thing or it's a woman centric thing, but is to work through contradictions. Like when I say that I can't stand my husband, but he's been quite supportive during labor. So so I don't know. So people don't get it. We don't get how you fight with your partner all the time, but you're still making babies with him. So,
Yeah, I do know.
that kind of, yeah, I still like being touched. I still like being intimate, but it's not something that you can explain, So like, this is going to be my fourth baby, and I've never had a baby shower.
Mm.
And I was just discussing it with Tapasya Appa because I think with all of my pregnancies, people were more concerned for me that, you don't have a house, you don't have a career, you fight all the time, you don't have a plan, you're not vaccinating, you're homeschooling, you're doing this, I've changed 5 cities in 5 years. So people are like, everything is so unstable. And I don't have rationale or the words to express my comfort with the instability, and that. So those are the kind of things, Um, I don't know, like if I'm answering your question or not.
You gave me validation of one thing I was thinking. And certainly I've noticed, you can, I have seen women who kind of get whingy during their late pregnancies and suddenly have a baby, no problem. Because when the tough gets going, then they get up and do what they need to do because they actually don't want to be in labor. So they quickly have their babies, meaning they actually do have control over what they're doing. And I've certainly seen that on more than one occasion on either side of the road, either a woman choosing to have a home birth who really didn't want one, only was having it because all her friends were having it. And she ended up in the hospital anyway, because that's where she really wanted to be. And then other times, like I'm saying, women who appear to not be able to pull it together, but in labor, they actually pull it together because they don't want to be in labor. And they know it's the only way out is to end it, have the baby. So there is that in the back of my mind, that when push comes to shove, that this woman will pull it together and make a decision in labor that I'd rather just have my baby than continue to have these dramas and then go to the hospital. So a little bit I'm hoping about this.
Yeah, I think, the difference is that, in labor, the physiology really takes over. And otherwise, we are all always in our thinking head. We are always trying to, being diplomatic, not to offend anyone, how to say no to something, how to say yes, and, the dealing with guilt. But
Mm,
when in labor, we are just beyond that part of our brain. So if given an opportunity, if any woman is given that opportunity to so-called zone out, they can really zone into themselves, their true self, which is really
mm,
powerful. That's what I feel, that it's not something that I could do. I just feel anyone can do that if they are just, if you just let them be.
yep. Agreed. Agreed. Yeah. Thank you. That was good.
Yeah.
Hey, Payal, what are you up to? You look busy. You're muted. Unmute. Where's your daughter for the technology? Okay.
Uh, yeah, so I just, thought of, got a little bit of time, so thought of, telling hi to everyone. So how are you, Puna? Have you reached Australia?
Yep. Can't you see there's sunlight and blue skies,
Ah,
but my car won't start. I have to jump my car and get it going. Then I'll drive 7 hours home tonight.
wow.
That's what you
Okay,
get.
Puna, in Hawaii, it means grandma.
Yes, yes, yes. That's what my kids call me. My grandkids and everybody calls me Puna here. Are you being, oh, what's that? Yeah, it means grandmother. So yeah. They're wondering what to call me. Oh, really? Puna.
Yeah, that's
Okay.
Dati. So Divi calls you KL Dati. So that's
Oh,
Puna.
that's okay.
Now I get it. I have
Just don't call
two.
me, as they say in Australia, just don't call me late for dinner.
So how was your trip? I think, Puna, you had a wonderful trip from India to Australia.
It was okay. I don't like traveling anymore. I'm kind of over it. But that's okay. I'm here. I saw my kids, see my grandkids, so that's nice. And we'll see what happens next.
So when you are planning to come back to India?
The 11th of March.
11th of March.
Yeah, just a quick trip. I'm just packing up, getting my stuff. Hopefully shipping a lot of stuff over to India to play with, like a kiln and my glass and lots of fun things, lots of books and equipment and things that I left behind. So we were kind of talking about, actually, Lolita Kun, for those who know, I'm talking about that story. As a way of explaining soap. I was trying to, so doing both together. So soap is a system of note-taking where I'm kind of an analytical person. So I like to write things down, and then I like to make plans. And so with this soap, part of what's in your soap is when you start analyzing, you'll look at your data, the subjective and objective data, and looking at all of that, you'll start researching. Now, what do I need to look up? So for this story that we're telling, I want to look up prolapsed bladder. I want to look up issues with kidneys. I want to look at what potential homeopathics could work in this particular story. As I say, we did have, okay, part of what, and then from there we moved to the plan. So what's the plan? We were going to talk to the homeopath that also has been working with her, and she kind of concurs with what we're saying. I will now add to the plan, sit down and have a good conversation with her, discuss responsibilities, discuss alternatives. So I think Radhakund and Danishta, you're caught up on this case, right? Yeah. So from the park onward, you're caught up. And I think we talked about it. Certainly we talked about it within her group, but maybe in the bigger group. And I'm using her as an example to work through how does SOAP, S-O-A-P, note-taking work. So we discussed the subjective stuff that we've seen, the complaints that she's had, and different issues. Objectively, we know what her test results have been, what her history has been, like this. And then we analyze what we're thinking of. So we've just gone through the analyzing of what's happening with her. And now we move forward to the planning. What are we going to do next? So based on the discussions that we've had here, and so to recap for me, you know, this subjective and objective, and pretty much, you know, my opinion, my analyzing, which is from a grumpy side that I explained to them how I felt about the niche, about Sabita, and how I was ready to throw in the towel, but you guys wouldn't let me. And Kalindi came in and set everybody straight. And Sabita went on to have a wonderful home birth. So using, being aware of who I am and how I am at the moment, I explain what I thought, which you guys know, which was frustration. And unless she pulls it together, I want her to. So you go through SOAP with each not always, but it certainly is. If I'm looking at a problem, and right now I'm looking at a problem, an ongoing problem. Like I say, from the very beginning, I've met this woman, there's been nothing but problems every visit. To the point where I got very frustrated and I was ready just to chuck her in. In Juleka, not so much. And probably the other students are a little more merciful than I am now. So they probably are willing to give her another extra go. Go for it. Go forth, children, go forth. Just don't bother me. So we're looking, so in a situation like this, yes, if I have, not just with any pregnancy, my normal routine, if somebody comes to me with a complaint, is I go over their diet, I go over their history, and I work on this level. But if it continues to represent itself, then I will sit down and write a method out. Really what I'm doing is charting a methodology, right? And I'm making sure I cover all the bases, the things that she tells me, the things that I see, and the results of the findings or results of any tests that may have been done. Then we analyze it, we sit back, we look at everything, we discuss the possibility. So at this point in time, after following the when we analyze it, we come up with two angles, right? I'm saying it's emotional and she's not willing to be strong enough. Others are saying it's a physiological issue. Or maybe I'm thinking it's a combination of the two, actually, because understanding some of the symptoms of urinary tract infections, bladder infection, it comes from, as what's her name? Heal Thyself. Who wrote that? Anyway, she relates things. And so commonly UTIs and bladder issues deal with being pissed off. I'm pissed off. I'm angry. And of course, women are not trained to express their anger, or they're actually trained to snuff their anger, which is why we have urinary tract infections, because we're actually pissed off. So again, I'm analyzing. So from this discussion, running it past a variety of people, I feel like this is what we will do. We'll go back to Lalita Kund and explain to her what we are seeing. Explain to her what her responsibilities are. I'm assuming Radhakund and Denisha played the message that Indulekha told us that Lalita Kund is feeling that so that's it. You're just going to, forget how she put it, but abandon her, dump her, something like this. So I'm agreeing. I think it's good to go over and talk with her further and explain what we're seeing, what we're thinking, and why we're seeing and thinking this way. In part, I protect myself now, right? And because I'm trying to do something bigger than just catch one or two babies, I'm trying to do something more. Yes, discuss the fears, the dreams, expectations. Dreams we did, stories she knows. Yes, we can do that. Her visualization of birth we haven't done and we can do. And where we lie in all of this, indeed. So this is fair. This is fair and just, as in terms of having been accepted this relationship as a midwife. That's a fair plan. I might add to that plan as a scare tactic, if I'm allowed to do that. Go talk to a doctor. Go to the hospital. See, you actually really should look at your choices and get a real taste of what the choices are. So and my hope is that she will develop a severe distaste of what she sees, that she'll buckle down and have her baby. Not as well, it's a reality check. And yeah, reality is scary. You know, so it absolutely is fair. It's absolutely fair for all of us to look after ourselves, look after our families, and we all have other mothers to look after too. Yeah. I mean, a little bit, I pause because I'm thinking of the issues in India when you transfer. It's difficult, it's different here, there than it is here. For instance, I can go to any hospital and no one would ever turn me away. Never. In India, they won't take you in. You can't get away with that in the West. But yeah, I've actually experienced it in India and it's not pleasant. And of course, we know that they torture the women when they get in. And then your reputation goes to shit too, but that's part of it. But it's part of it. That's why I talk it. Okay. So that's the soap. I've come to the plan. What do you reckon? Okay.
I have a question though.
Yep.
In all this, will there ever be a plan to, can we help the bladder go in? I think you did explain to me last time I had this question. Can we manually do it? Take the bladder in?
Yes. Yes. But okay, so my concern is that the bladder will prolapse into the vaginal cavity enough to obstruct the baby from continuing to descend. It's the same issue of having, what is it? A full bladder, distended bladder, and that you end up catheterizing, as we had to do with Sulalita. So yeah, I'm kind of concerned about this. I'm wondering if I can push it up. But actually when I don't have any books on me now. But certainly as soon as I met her, I grabbed all my books and did all the research I could, and it wasn't pretty. No one felt confident, not even Anne Fry. Or neither Anne Fry nor Elizabeth Davis were comfortable with a bladder prolapse at home. I did not get the feeling that they had experienced it, but they certainly did just kind of say it's kind of not doable. So I did work, as we say, we were working on her with exercise and yoga and Reiki and massage. And she did get better. She did start standing up straight, and I could feel her bladder her baby, her uterus lifts up. But it is also clear that we measure her uterus has dropped, not because the baby's engaged, because she doesn't have the muscle tone isn't good. That's what I'm thinking, because it's her first baby, and her uterus is always measured low. Her baby is always low, like right there. So yeah, I don't know. I don't think it'll kill her if we give her a trial of labor, right? What's the worst that's going to happen? We end up where we're worried. We end up where we're worried we're going to end up. So just transferring is unpleasant in India. And
Is she
so,
using a belly band to support her belly?
yes, yeah. Oh, actually, I think I discussed this with you guys too, that in some of the research I did, they discussed using pessary, which I used also because I have everything prolapses for me. I've got everything prolapse. My throat is down there. So big tonsils. So it's this rubber ring. It's like about different sizes from say this to this. And you fold it up and you insert it in your vagina, and then it opens up, and it's supposed to just sit above your pubic bone and fill that pelvic cavity. And in this way, hold everything up. So this is suggested or discussed. I did not find anybody in India who was familiar with this. I personally used it and I didn't like it. I actually got really, really sick with it. So it does have, it can increase infections. I didn't like it. You're supposed to put it in every day, pull it out. It pinches sometimes. It doesn't feel good when it catches your urethra. And yeah, I got a massive urinary tract infection that believe it or not, ended up becoming pneumonia. Go figure. I told you everything was prolapsed. My lungs, my diaphragm. So So that's there, but it didn't come to pass. I just kind of felt that the exercise would help her. Anyway, I don't know. But the main thing for me is she willing? Can she do this? Is she strong? Either she's, oh, I'm so bad. Either she's a wuss and she can't get her shit together, or she's sick, or she's physically impaired some way, right? And I can definitely accept that she has been physically impaired through her history. Yeah, we'll see. I don't know. Thoughts?
I'm just thinking that, hopefully this just goes and moves forward and she's able to birth at home and the prolapse doesn't go anywhere beyond where it has been. And I see that as I don't know. That's where my head is.
Well, the funny thing, okay, so like I kind of mentioned too, that my student is doing this, like in Daleka, I'm trying to stand behind her. She's going through something serious too right now. And it just happened, right? It just must have happened in the last 48 hours. So some trauma is happening within her family. We all, it's hard to help somebody if they can't help themselves. Yeah. And I personally, and I've said it repeatedly, I'm not in a position to do that anymore. And some of you are not in a position to do that at any time. Some of you can, some of the time, but you can't do it all of the time. And that's it. So each individual midwife or care provider has to decide for herself and for her family, right? Mother of twins over there, mother of almost teenagers over there, and somebody else juggling babies. I see you. Who's that? Who's that? Nothing. I'm on a Zoom call. Nobody's juggling babies here. He's just rocking a baby.
He will be juggling soon in a month or so.
In a month, he'll be juggling 4 babies. Don't worry, I had 5. I'm still trying to get over it. So what was I? Oh, so it's serious. You guys have to look after yourselves and after your families too. That's all I can say, I guess. And then we just play it by ear, like everything, you play it by ear. He went with Paul. Okay, anything else? No. No. Not Indian. She's asked me what I want to eat when we go for dinner. I've had enough Indian for, yeah, I'll go somewhere else now. It was great. No. You see why I'm crazy now, right? You understand. I don't get to make my funny faces? Aw. Yeah, we are professional midwives. It is. In Hawaii, we do it. It's called, if there is a TV show for kids. I'm Captain Honolulu. So anything else, ladies, guys, people? Can I have the baby that you're holding? Can I have the baby you're holding? Yeah, that one. Can I have it?
No, no, that's my baby.
No, it's my baby. Can I have you? Go away,
No, no,
Tapasya.
I caught that baby. That's mine.
Somebody mute Tapasya. Mute Tapasya. Come here, baby. You're mine. Come.
He tried coming through the screen and the phone fell.
Look at you. Look at you. You're going to be the big brother, brother or sister? Brother.
Mm,
Isn't that
Kabir.
ridiculous?
Yeah, big.
I did the same thing.
Did you manage to get Mary's
Not yet. I'll get to it next.
whole try and
He did.
work?
No. I killed his battery.
I suppose you're having all the coffee and garlic onion that you couldn't have in my.
No, I like Asian food. So I've had Japanese. I had Vietnamese. I don't know what we're going to have tonight, maybe. Japanese. Yeah. She mentioned Italian, but nah. I am Italian.
I heard recently something that they have made a law in Hawaii that even if you're a doula, you will considered to be practicing midwifery without license, which is insane.
I don't know.
Yeah,
I've
they
been
recently
seeing a few
passed a
things.
law.
I've been seeing a few things, even, oh, they passed it. I know it came up, but the thing is they will always have issues because in America, you cannot stomp on somebody's traditions. And especially for Native Americans, which Hawaiians are Native Hawaiians, but anyway, they actually can't stop Hawaiians from doing what Hawaiians want to do culturally, which it is our culture. And we have a cultural practice of midwifery, always have. Exactly. Exactly. That's where I got my initial beginning, was with the Amish and Mennonites in Philadelphia, Pennsylvania, I mean.
No, I'm just thinking, there is going to come a point where doctors are going to protest what we are doing in India, what we are trying to do.
Yep.
Maybe
I
5
agree.
years, 10 years down the line, and they would want to push, licensing and controlling child birth educators, even doulas, midwifery thought
Already
of
there.
question.
2018, they passed a guideline that midwives are going to be trained by the government only.
Yeah.
And that's how they're gonna, so we will all have to work as far as supporting women at home undercover. So,
Well, to be honest,
will-
most of us started that way. When and across the United States, every state has a separate law. It changes from anyone can do anything, whereas no one can do anything. So, but still, midwifery and home births have always gone on. And this morning, I just saw something on the Australian news about free birthing. And I was trying to read it, and I lost it, so I didn't see it, but I'm sure it has nothing nice to say.
No, it's because the free birth has, risen dramatically in Australia after COVID. Like people are free birthing right, left, center.
And they never
So
stop
it's-
to think, why are people making this choice?
yeah, they've put
People
out
are
articles
making this
again.
choice because what's on offer is not acceptable. And even conservative people are now choosing free birthing or home birthing because what's standard is unacceptable. And look, for me personally, I can't let the laws of a penis tell me what to do. A woman gives birth. I will not let a penis tell me how to do it. This is what the hospital did, right? They're trying to shut me down. Straight away, I say no. I've always been a home birth midwife and I won't stop. I will always serve the women. I will not serve the man. I got one of those. He's gone now. I did my job. My job is to serve women. And when you serve them, they know how to give birth. You want to make laws, go ahead. I'm stronger than your laws. Go ahead and arrest me. Throw me in jail. I'm stronger than that. And frankly, my experience has been, because I worked in Australia illegally for over 20 years in a small area that everybody knew who I was. Every doctor, every hospital knew what I was doing. And if I had to take somebody in, they all knew. And the parents would lie. No, she was just helping us. We were just on our own and she was there. And even in the case of a death, they would go after the parents and ask them. They wouldn't charge the parents because the parents have a legal right to birth wherever they want. But I do not have a legal right to offer my services. So the parents, you just end up developing a relationship. And again, I always believe in this path with God, that he has protected me because he wants me to do this. I've told you the stories where I get named in court and nobody knows who. I can't figure it out. And the person who's there, the lawyer, knew me somehow or other. He just got a mind blank. It didn't recognize. It didn't make sense. His sister was my apprentice for 13 years. And suddenly he just had a mind fart and he couldn't remember who I was. And they have been after me and they never got me. And I just believe I'm being protected. And the moment God doesn't protect me anymore, then I'm dead meat. So be it. That's a good thing about being old too. Go on, come on, bring it on. I'm ready for the long sleep. I dare you.
Yeah. Now, that's what Vapio says. If you serve in evolution, you will not be wasted. Universe will always protect you because you are one of the forces that is, serving the evolution. So it's not easy to remove you just like that.
And I'm feeling
like
more of
that.
yeah. I've always felt like this was, I've always felt that this was God directed and God guided. And I've always been amazed at how I've gotten away with shit. That I, really technically there's no way how I got away with stuff, but I did. And lately I'm thinking more and more, especially being in India and this past year, I'm clicking in more into the goddess worshiping. You guys have so many goddesses, right? And you love your goddesses. Durga Ma, Lakshmi Devi, Saraswati. So the women are the goddesses. They're the representatives of the goddess. And I kind of want to try to focus on bringing that in and kind of praying to the goddesses and asking them, reaching out to them, please help us. Please let us serve you. And as I serve these mothers, as I, KL, provide service to these women, I hope you accept it as service unto yourself. And Lakshmi sits on Narayan's chest, right? And who's Durga Ma with? So I hope that in my serving and respecting these women who are representatives of the goddess, then hopefully I'm doing the right thing. And in exchange, we'll all work together. Yeah. And for me, goddess also means the earth. For Hawaiians, the goddess is in the land, in the dirt. We stomp. You know this, Divya. Punjabis stomp on the ground. Many Native people stomp your feet on the ground, and we connect to nature, the goddess, and the Lord, because we're part of it when we spill our blood on the ground.
Yeah. Fortunately, like I see a silver lining that in India, they cannot make home birth illegal. I mean, birthing wherever you want, it's a basic human right. And in a huge country like India, I don't see that possibility happening because we
Me
don't have.
neither.
So, yeah. So
They can't
that
organize
is
themselves for anything. How are they going to bust home
I-
births?
yeah. Yeah.
They
So
don't, yeah.
yeah. They maybe they will make, practice of medicine is anyway illegal. I want to know what they define as practice of midwifery, and then we can devise our ways to protect us. But right now, there's no need. We just go on doing what we were doing.
Just going on. But actually, you just said something very interesting. What is the practice of midwifery? The practice of midwifery is not the practice of medicine. We do not, and in
Exactly.
fact, yeah, this woman contacted me yesterday, I guess it was, and she's asking about, she's pregnant, and oh, she's had 2 cesareans, that's it. And she doesn't want to have another one. So I say yes. And I think we said some pain came up. So how do you give it in? Will you give an injection for pain? No, that is the practice of medicine. I will not practice medicine. Just give you this for pain. I will do CPR. I will put in an IV if you're bleeding out. I will do the needful if I see a need. But I'm not gonna, yeah, no, I don't do that. So we are allowed, and in fact, there is a law, and I'll look it up better, the Good Samaritan law, where you don't, and it's there so you do not get penalized for providing care to somebody who needs it. Does that make sense? So if you come upon, okay, we have this example. The example of the one I'm talking about, the woman who passed out at the markets. And then they called the ambulance, and then she didn't want to use the ambulance. And the ambulance driver was freaked out. He spent another 45 minutes or something tracking down who called the ambulance. And they were very, very concerned to charge that woman. And they went through and finally found who called the ambulance. And they made her pay for the ambulance. So in the West, they created this law called the Good Samaritan Act. So because if without this act, so now the people who stood by in that park, no, don't call an ambulance. If somebody collapses or has a heart attack or bleeding out, don't you dare call an ambulance because you might have to pay for it. So that's why they created the Good Samaritan Act, so that people will step up and do the needful. And also, like if you step up and try to resuscitate somebody and break a rib, you don't get charged. And you're not responsible to pay for the ambulance. It's stupid. Why was I telling you that? The Good Samaritan Act? What's this about? I already forgot.
Yeah, I don't know either. So anyway, I somehow based on your in-person review of the conference, I was very interested in that. What
Okay.
you felt through the interactions, and I mean, the conference was fabulous. It was organized really well. What was your feeling? Where the movement towards natural birth in India is going right now? What do you feel about that?
I'm glad that they're looking at there's issues to there can be improvement. So I'm happy to hear that. It is still, as a home birth midwife for a long, long time, so the people there are all hospital. Even that Augustine, she's American, but she's got a birth center, and they were both, she and actually Kalyani, who was here, kind of weren't so approving of the home birth aspect. I think, Kalyani was okay. It was Augustine who really poo-pooed it. So they focused a lot. This was one thing I noticed, is that they focused a lot, and it came up about the mental health of the mothers after delivery. So there was lots of discussion of how to address birth trauma and doing rebirthing and postpartum care, extending on postpartum care and extending on breastfeeding preparation. But I kind of was, well, why are we focusing on healing the mother? Why don't we stop the abuse? So all these, yeah. So they certainly still fall back on that medical aspect, but I did find that they were open-minded to learning more, the students anyway. Those who like to control don't like to lose control. Yeah. But actually, the whole system a little bit needs to be shaken up, because so they're walking, actually, to be honest, the system needs to be shaken up, and I'm kind of determined to expose it to internationally. What goes on is not on. You do not get to hit women. You do not get to slap women. You do not get to put in IUDs without telling them. Manual removal of every placenta is completely unnecessary. You do not need to catheterize every woman. So on and so forth.
And tie their tubes without their knowledge when they have 3 or more kids.
And if you're a village woman, if you're a poor village woman, you go to the government hospital, they will put an IUD in you because they don't want you to have any more babies. And this was a 15-year-old girl, no less. And they stuck this into her. And of course, the practice of putting any IUD into a uterus immediately after a placenta has been removed at all, what to speak of manually removed, you do not put a copper IUD in a uterus starting to heal. That is death on a doorstep. And indeed, this woman was sick as a dog, and she reached inside, found these strings that were coming out of her cervix, and pulled it out and got better. Squatting over cow patties, lit cow patties, and she healed herself. Having 30 women labor in a room together doesn't work. And that's what's going on. You've got women separated by curtains, but it's a huge ass ward. And everybody's there with another woman or two. This is not how you go into labor. How can you labor? And then the delivery itself, they have 4 beds at a time. So they will have 4 women in the same room delivering at the same time. This doesn't work. And then if they go to a cesarean, as I've said, and you cannot operate on 2 women at the same time. It's not. It has to be reported. It has to be reported. This can't go on. And I wonder why women can't have babies again. Why are they having so many cesareans? When I went to the school, and it was a Sai Baba hospital, which was really schmick, really nice. And this is the hospital I'm talking about, though. And they were very, very interested in learning about natural birth. they did confess that even with their best efforts, they still have a 40% cesarean rate, which is still unacceptable. It's better than anywhere else in India, but it's still unacceptable. So they were enthusiastic to learn things differently. They were enthusiastic to send their students to me to teach them natural birth, because nobody has seen it. Haven't you been to the paddocks? Haven't you been to a Goshala? Don't you have cats? But yeah, so that would be cool if I can. So the deal is, people, we have to infiltrate. We have to infiltrate. Oh, something else. So of course, when I was speaking, I'm doing my rough speech, and I did say, get angry, get angry. Don't let doctors get away with the shit that they're getting away with. Don't let them do this. Don't let them do this. Get angry. And then somebody said, but we can't, we'll lose our jobs. Oh, okay. The mothers can get angry. They're not going to lose their jobs. They're just too chicken to do it, but we have to encourage them to get angry. Okay, so the workers, the staff, the nurses, the midwives, they didn't even know what a midwife was, actually. So we need to create a place where they can come, where people can make complaints against practitioners and hospitals. And I think we should, again, and I made this point at that conference, you underestimate the power consumer rights has. You, the mothers, are the consumers. We are buying a product. We're buying a product, a service from a person or an institution. If they do not provide the service or care that I want, I don't pay them. And I give them shit reviews. And nobody else goes to them. And that's how in the West we control our doctors. The women, the people, the patients control, because we withhold. Women control because we can withhold. And as I said repeatedly, what would happen if an army of angry women marched on your hospital and they all stopped, and that actually just one woman, it only takes one. So we need to get up and march. You need to get angry. So I came out of this thinking we need to create a safe space, website, something where they can go register their complaints anonymously and have their jobs protected. So that's among the things that we can do. And that will instantly improve maternity care. And who was it? Was it you, Tapasya, was relating some story that they're going past the gynecologist was talking about the breastfeeding. That's just a scam. You know, we'll prepare them, but it's a scam. They're not going to breastfeed. We're going to bottle feed them. You know, so the whole preparation they just believe is a scam. They just want to get the babies onto the bottle as soon as possible and get the mothers out of the hospital as soon as possible too. Right. Yeah. Well, see,
Yeah.
only because they get away with it. They get away with it. If you expose them internationally, especially India, man, you guys don't like that flashlight. You don't like the light on you. I'm shining the light. There are international conferences. Come, speak, speak. Join me. And I swear, it'll turn around, but it won't turn around unless you stand up and fight for it to turn around. And I keep hearing it. We're gonna have a revolution. Yeah, you know, we all want to save the world. It's gonna take a revolution, yeah, you know. We are gonna change the world. So let's do it. An army of angry women and their babies.
Yeah, about this saving thing. I mean, I have seen this, I don't know, in many groups that there needs to be a white midwife who needs to come and teach. And, you know, somehow Indian women are too weak to become midwives, or if they want to become midwives, they have to go to nursing schools and become midwives. I don't know if I'm putting it in right words, but that has been my experience, you know, somewhere around. I don't want to name this person, but that's what they say. You know, you go to USA, spend so much money, get a CPM, and come back to India and do midwifery and some crap that, you know, a white woman has to save us. I'm not saying that about you, Kale, because you're totally Indian. but it is there that, you know, Indian women cannot be midwives just like you. There is some kind of complex, some underconfidence, something that I see in people, that they think that, you know, oh, how can we do attend home births, you know, this is something Americans and English people have to come and do for us here. Even in Mumbai, there used to be a group of midwives which were from UK, and when they went, they were like, oh, there are no midwives in Mumbai. Come on, we have a full army of traditional
You
midwives,
have a
but we are
full
not
army.
even. Yeah.
So we just have to get the highlight on them, get their voices heard. And well, also well, I know it's not Shaman who wrote this, but about the system collapsing. And certainly this is one thing we found with COVID, is that things change drastically. And that actually you do need to get back to the grassroots evolution, get back to what actually matters, which is clean air, clean water, good land, good dirt, food. That's what's the basics. And as you say, the wise women or the old people can teach. And actually, every now and then I do run into a strong enough Indian woman. One is named Tapasya, the other is named Divya. And and Sabita, I've got some other women who just gave birth at home, some Bengali women or Bangladeshi women, and they're happy to start. They want to start doing this. So I think this is good. They're ready to, oh, and even her husband, they were so moved by what happened that they're ready to go out and prepare others and start this. So I think it can happen. I think it can, I think the women can be stirred back up because, and again, okay, so my belief, part of the reason why they don't get stirred up is because they're put down from the moment they're conceived. Women are not born, aren't shared this preciousness or importance, but actually, you know, most really, nah. So it's hard for a woman to, and hard for any woman to stand up anywhere in the world, but sure as hell it's going to be harder there from the very beginning. It's quite common around the world. Women can't get angry. Women have to be sweet and nice. And we have to talk like this. And actually, somebody shared that Barbie, an episode, a scene from Barbie movie, you know? So it's quite around the world that women are pressurized to be pretty and cute and shut up. But you know what my speech is. No, don't do that. You need to stand up and be strong. You have to fight. You are a woman, so you must fight. Fight for your children, for your daughters. Ah. Who do you worship? Durga Ma? Get your Durga on. Get your Durga on. Come on, women. Like I say, you guys pushed out the British. Do it again. Do it again. You can. And it's the only way. It's the only way. It's like for the mothers, there's no change in this. Whatever happens, the mother, you have to give birth. I can't do this for you. Similarly, I cannot change the system for you. You have to change it yourself.
Is wandering around, so just
Okay, I'll put my shirt back on.
good. I'm glad. I'm sure we're all glad.
Yeah. But I actually feel strongly about it. I feel it's the only option you have. Yeah. You have to fight. I'm sorry. And actually, Indian women now need to learn to get up and go wild and fight. Rah!
How you doing?
I just scared the mystery that came in. Oh, an electrician. Yeah, so what do you think? Any other questions or anything? Okay, now I look stupid. Somebody speak. Was it? Okay, good.
Yeah, I would like to share something. I recently, with lots of effort, I found one contact in Colombo, who is a childbirth educator.
Yep.
And she's, I didn't even initially tell her what I do. And she was like, oh, yeah, it's nice if you come, you could go to the hospitals and talk to directors and do something. I was like, lady, I don't go to hospitals. And she's, oh, no, 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 no. Then the nurses union and this and that is very strong here in Colombo. If you do something like this, everybody
you
knows
gonna do?
everybody.
What you
I'm
gonna
gonna
do?
attend home births.
No, not you. I'm asking them. The nurses don't approve. Oh yeah, what you gonna do?
Yeah.
What you gonna do?
So
You know,
I will go there and read the law of the land and see how it goes. But I know for sure there will be women in Sri Lanka who don't want to go to hospital. There has to be. Everywhere in the world there are.
everywhere in the world, and especially everywhere in India, because everybody in India knows what they're going in for. So you actually have a large support team behind you. Indeed, they're not particularly warrior-like, but you talk about talking and going, speaking in the hospital or something. And I've been invited to hospitals. Everybody knows I'm a lay midwife. I'm unregistered. I'm traditional, but I get invited to John Hopkins to important to important places to speak to the enemy, let's say, and they listen to me. I don't know if they follow me or if follow my advice, but you make a statement, you stand your ground, and nobody anywhere actually everybody knows what's happening in India is wrong, right? Even the doctors with 100% cesarean rate knows this isn't right. They just also know no one will challenge them. So let's start challenging, because the rest of the world supports you. There are conferences all around the world about natural childbirth. Absolutely come and give your evidence, because I'm going to, and I'm naming names and I'm naming the hospitals. Oh yeah, I'm not afraid. What are they gonna do? Put me in jail. Yep. Okay. I'm sorry, I don't have anything. I just see that it's essential. As far as childbirth, natural childbirth in India, I think you have no choice. I think it's essential. You must get up and fight. You have no option. You have no alternative except to get on the conveyor belt. Jump on the conveyor belt or fight and blow that goddamn conveyor belt up. Do it. Do it. I'll help you. I'll run with the bombs, okay? You just build them. But we should. Come on.
Yeah, I will have to figure out what to do in Colombo. Let's see.
Let's see.
Ah, maybe just write a book, sit and write a book. I don't know. I don't want to do
Exactly
that. I
right.
want to be at births. I want to be at births with charity.
So let's start a movement. We can certainly start a movement. Yeah, because everybody's asking for it. It's not just me walking in there saying, you guys got to do this. You know, I wouldn't be doing anything except that other people are walking up to me asking me for help. Yes, exactly right. Where you go and where you help people, you will get supporters, and they will continue, just like this here in Mayapur, where this woman has her baby and they're all ready to convert, and the whole family's ready to convert, and he's ready to support the men, you know, to have during the births. So, which is good. That's great. That's great. Okay. Anything else?
Thank you so much for taking out time for this. Where are you? Like, I don't think you're at your home.
No, I'm
What?
in Brisbane. I'm in Brisbane in my daughter's home.
That's why. Ah, yeah.
Yeah.
Because your home will be like all dust, and I don't know what you're gonna find.
When I
Cobras
go
and
home,
anacondas.
probably a few snakes in the house, a couple of kangaroos.
Ow.
I know. Yeah, I'm
So,
a little.
so who's gonna help you clean up all the mess, and what are you gonna do? Just stay in Brisbane.
No, I'm gonna. If I might get the car running tonight, or I'll go tomorrow for sure. Tomorrow I'll leave. But otherwise I'll leave tonight. I'm sure everything's working because people go there. As long as I have water, that's the important thing. Just make sure I have water. Even if I don't have power, I'll survive. I've got a generator. But water, you can't replace water. So that's one thing you learn on the land. Water.
Like, where do you gather courage to, just throw yourself open in the wilderness again?
By thinking very little. Don't overthink it. In fact, try not to think at all.
Yeah, that works.
It does. That's why I had 5 kids. I was never thinking. Right, Prahlad? Yep. Yep, sure, she says. No, I don't know. To be honest, and I do often think about it because I do hear about how women think when they're pregnant and the stuff that they come up with. And it's never been anything I thought about. I actually never had expectations. I actually expect my life to be kind of shitty. So I'm never disappointed. So I get what I expect. And I'm just getting used to doing things for myself, which is good. So we'll see, but it'll be fun. It'll be fun. Okay, everyone, thank you so much. And okay, today was Friday. So Tuesday, and I'll be back in Agnes, where you saw before, and there'll be palm trees behind me. And maybe I'll take you for a walk and we can see. Okay. Thank you. Haribo. See you later. See you later. Take care. We're starting a revolution. Get angry. Whee!